Today we will talk about what is vacuum aspiration. Here we can see this is a vacuum aspiration instrument. It's about 100 centimeters tall, and this is a consumable for vacuum aspiration. Every patient uses different consumable. It is not reusable. After doctor detects the tumor on the ultrasound, we can use vacuum aspiration to scrape up all the tumors one by one. Which patients can use vacuum aspiration? Could it also be used by patients with breast cancer? Many patients come to feel a hard lump. They came to the clinic and asked me, "Doctor, can I just get my tumor removed?" In my clinic, I usually suggest that palpable mass. I usually suggest perform a core needle biopsy first, then do vacuum aspiration surgery to remove it. It's mainly because palpable mass, even under the ultrasound, tumor looks like benign, but there are still some patients cancer is noted after it is completely removed. That's it, breast cancer. If the vacuum aspiration performed first and the pathology report is cancer, the patient still needs to do the traditional surgery again. Core needle biopsy can reduce the probability of cancer after vacuum aspiration. It can also reduce patient out-of-pocket expenses. Also, we can know vacuum aspiration is to remove the entire tumor, and core needle biopsy just sampling. So vacuum aspiration has higher accuracy in diagnosing breast cancer than core needle biopsy. Because of a progression of vacuum aspiration, if one breast cancer patient combined with other breast cancer, we suggest perform biopsy for all breast lesions. For example, my breast cancer patient after vacum-assisted excision for other breast lesions, up to 30% patients also has other breast cancer at the same time. In the literature review, breast cancer patient has secondary breast cancer. That means breast cancer outside the primary breast cancer, the rate of secondary is around 3 to 30%. The rate is compatible with the rate of detecting other breast cancers during vacuum-assisted excision. So we can say that vacuum-assisted breast biopsy could early detect and remove breast cancer usually high diagnosed early, also reduce the chance of recurrence in breast cancer. How does vacuum aspiration perform? Will it hurt during operation? Which method we use? How to care after surgery? Will one be dimpled? Breast lesion that patients feel if it is a tumor under the ultrasound, and if it is confirmed benign after core needle biopsy, we could perform vacuum-assisted breast excision. In a smaller tumor, we consider local anesthesia. In a bigger tumor or had several breast tumors, if planned VABE, we consider general anesthesia. VAB and the local anesthesia could perform in a clinic or in a technical room or in the operating room. But if it is VAB under general anesthesia, it could perform only in the operating room. Patients under general anesthesia, when they enter the operating room, the paramedic will take them to the operating room. And when the patient lies down, the paramedic will ask the patient the location of surgery. Anesthesiologist will get into the operating room, give the patient general anesthesia. After the anesthesia, the surgeon will use the ultrasound to locate all tumors that are planned for surgery. In the patient, all lesions need to mark. Then select 1 to 2 incision sites according to the position of tumors. Then disinfect all the tumor. After that, lay down a sterile cloth and inject the local anesthetic around the tumor before surgery to reduce bleeding after surgery. Here we'll see the procedure of vacuum-assisted breast excision. At the beginning, we will put consumable for VAE below the tumor, then targeting the tumor. After that, scrape up all the tumors one by one. The process of tumor resection can be seen by ultrasound, so we can excise all the extent of tumor ultrasound display. At the same time, we can find that the procedure of VAE couldn't perform electrocautery to stop bleeding the traditional surgery. So after VAE, the space of each surgery changed into hollow. After the operation, patients have to do local compression hemostasis to prevent hematoma and ecchymosis. Patients need compress the wound after surgery and compress 20 to 30 minutes every hour. After returning home, patients must continue pressurize. The wound shouldn't touch water. When the wound hasn't healed, it is not recommended to swim or go to a hot spring. It is easy to get wound infection. 3 to 5 days after surgery, strenuous activity is not recommended. This can easily result in extensive bruising. Because VAE cuts out the whole tumor, so if a relatively large tumor is removed, there may be a depression after surgery. The suggestion is that before the tumor grows up, let's cut it off first. This will reduce the problem of breast depression. VAB changes the way we treat breast. The surgical method described here may not be suitable for every patient, so each patient, when choosing surgical method, still need to discuss with your own attending physician to choose the most suitable method for you.